used to treat MTX toxicity. See Appendix 1 for solution. Drug therapy is dynamic and an ever-evolving science. It requires understanding of the drug, the disease, the patient and the milieu in which it is undertaken. When and what benefits are expected to be obtained from this? Why panto? Should it be continued or stopped? Drugs for cough. Cough is a protective reflex, its purpose being expulsion of respiratory secretions and foreign particles from air passages. It occurs due to stimulation of mechanorchemoreceptors in throat and respiratory passages or stretch receptors in the lungs. Cough may be useful or useless. Useless, non-productive, cough should be suppressed. Useful, productive, cough serves to drain the airway. Its suppression is not desirable, may even be harmful, except when the amount of expectoration achieved is small compared to the effort of continuous coughing. The commonest cause of acute cough, lasting less than 3 weeks, is respiratory viral infections. Apart from specific remedies, antibiotics, etc. See box on. Should it be continued or stopped? Drugs for cough. Cough is a protective reflex, its purpose being expulsion of respiratory secretions and foreign particles from air passages. It occurs due to stimulation of mechanorchemoreceptors in throat and respiratory passages or stretch receptors in the lungs. Cough may be useful or useless. Useless, non-productive, cough should be suppressed. Useful, productive, cough serves to drain the airway. Its suppression is not desirable, may even be harmful, except when the amount of expectoration achieved is small compared to the effort of continuous coughing. The commonest cause of acute cough, lasting less than 3 weeks, is respiratory viral infections. Apart from specific remedies, antibiotics, etc. See box on page 238. Cough may be treated as a symptom, non-specific therapy, with drugs for cough and bronchial asthma. Chapter 16. Respiratory system drugs. SE Court IO. N4. 238 Respiratory system drugs. DEMULCENTS and EXPECTORANTS. Pharyngeal demulcents soothe the throat and reduce afferent impulses from the inflamed, irritated pharyngeal mucosa, thus provide symptomatic relief in dry cough arising from throat. Expectorants, mucokinetics, are drugs believed to increase bronchial secretion or reduce its viscosity, facilitating its removal by coughing. Sodium and potassium citrate are considered to increase bronchial secretion by salt action. Potassium iodide is secreted by bronchial glands and can irritate the airway mucosa. Prolonged use can affect thyroid function and produce iodism. It is not used now. Guaifenesin, Visaka, Tolu balsam are plant products which are supposed to enhance bronchial secretion and mucociliary function while being secreted by tracheobronchial glands. Ammonium salts are nauseating, reflexly increase respiratory secretions. A variety of expectorant formulations containing an assortment of the above ingredients, often in combination with antitussives, antihistaminics, are marketed and briskly promoted, but objective evidence of efficacy of expectorants is non-conclusive. The US FDA has stopped marketing of all expectorants, except guaifenesin. Steam inhalation and proper hydration may be more helpful in clearing airway mucus. Mucolytics. Bromhexine, a derivative of the alkaloid vasicine obtained from Aditoda vasica, Visaka, is a mucolytic and mucokinetic, capable of inducing thin copious bronchial secretion. It depolymerizes mucopolysaccharides directly as well as by liberating lysosomal enzymes. Network of fibers in tenacious sputum is broken. It is particularly useful if mucus plugs are present. Side effects are rhinorrhea and lacrimation, nausea, gastric irritation, hypersensitivity. Dose. Adults 8 mg TDS, children 1 to 5 years 4 mg BD, 5 to 10 years 4 mg TDS. Bromhexine 8 mg tablet, 4 mg, 5 ml elixir. Ambroxol, a metabolite of bromhexine having similar mucolytic action, uses and side effects. Dose: 15–30 mg TDS. AMBRIL, Ambrolite, AMBRODIL, MUCOLITE 30 mg tab, 30 mg, 5 ml liquid, 7.5 mg per milliliter drops, a 75 mg CR tab. Acetylcysteine, it opens disulfide bonds in mucoproteins present in sputum and makes it less viscid. It can be administered orally, 200–600 mg TDS, as well as by inhalation of 10 to 20% nebulized solution. In intubated patients, the thick sticky secretion can be liquefied by installation of 10 to 20% acetylcysteine solution directly into the respiratory tract. MUCOTAB 600 mg tab, FLUIMUCIL 200 mg, 600 mg effervescent tab, MUCOMIX 200 mg per milliliter INJ in 1, 2, 5 ml. AMPS. The injectable solution can be nebulized, instilled through tracheostomy tube. Specific treatment approaches to cough. Etiology of cough treatment approach. Upper, lower respiratory tract infection, appropriate antibiotics. Smoking, chronic bronchitis, bronchiectasis. Cessation of smoking, avoidance of pollutants, steam inhalation, postural drainage. Pulmonary tuberculosis, antitubercular drugs. Asthmatic cough, inhaled beta-2 agonists, corticosteroids, ipratropium. Cough in pulmonary eosinophilia, diethyl carbamazine citrate, inhaled corticosteroids. Postnasal drip due to sinusitis, antibiotic, nasal decongestant, H1 antihistaminic. Postnasal drip due to allergic, perennial rhinitis. Avoidance of precipitating factors, corticosteroid nasal spray, H1 antihistaminic. Gastroesophageal reflux, bedhead elevation, light dinner, diet modification, H2 blocker, proton pump inhibitor, mosapride. ACE inhibitor associated cough, substitute ACE inhibitor by angiotensin receptor blocker, NSAIDs may reduce cough. Post-viral cough, no specific treatment, subsides by itself. CHAPTR16. D for cough and bronchial asthma 239. The gastric mucus barrier may be breached by orally administered acetylcysteine. Carbocysteine, it liquefies viscid sputum in the same way as acetylcysteine and is administered orally, 250–750 mg TDS. Some patients of chronic bronchitis have been shown to benefit. It may break the gastric mucus barrier, therefore is contraindicated in peptic ulcer patients. Side effects are gastric discomfort and rashes. MUCODYNE 375 mg cap, 250 mg, 5 ml SEER. It is available in combination with amoxicillin or cephalexin for treatment of bronchitis, bronchiectasis, sinusitis, etc. CARBOMOX, carbocysteine 150 mg plus amoxicillin 250 or 500 mg caps. CARBICEF, carbocysteine 150 mg plus cephalexin 250 or 500 mg caps. Mucolytics are specifically useful in patients with tracheostomy, asthmatic bronchitis, cystic fibrosis, etc. who have thick tenacious sputum or mucus plugs. ANTITUSSIVES. These are drugs that act in the CNS to raise the threshold of cough center or act peripherally in the respiratory tract to reduce tussle impulses, or both these actions. Because they aim to control rather than eliminate cough, Antitussive drugs should be used only for dry non-productive cough or if it is unduly tiring, disturbs sleep or is hazardous, hernia, piles, cardiac disease, ocular surgery. Opioid antitussives. Morphine and its congeners are the most effective antitussives, but morphine is not suitable for treating cough because of its strong addicting and respiratory depressant property. Codeine, CCH. 34, an opium alkaloid, qualitatively similar to and less potent than morphine, but is more selective for cough center. Codeine is regarded as the standard antitussive, suppresses cough for about 6 hours. The antitussive action is blocked by naloxone, indicating that it is exerted through opioid receptors in the brain. That in certain opioid congeners, antitussive action can be dissociated from the analgesic addicting action, indicates that the receptors mediating the two actions are not identical. Abuse liability is low, but present. Constipation is the chief drawback. At higher doses, respiratory depression and drowsiness can occur, especially in children. Driving may be impaired. Like morphine, it is contraindicated in asthmatics and in patients with diminished respiratory reserve, should be avoided in children. Dose. Antitussive dose is lesser than analgesic dose. 10-30 mg. Children 2 to 6 years 2.5-5 mg, 6 to 12 years 5-10 mg, frequently used as syrup. Codeine foes. 4-8 ml. Codeine 15 mg tab, 15 mg, 5 ml Linctus. Ethylmorphine. It is closely related to codeine, which is methylmorphine, and has antitussive, respiratory depressant properties like it, but is believed to be less constipating. Dose. 10-30 mg TDS, Dianindon 16 mg tab. Fulcodeine. It has practically no analgesic or addicting property, but is similar in efficacy as antitussive to codeine and is longer acting, acts for 12 hours, dose, 10 to 15 mg. Non-opioid antitussives. Noscapine, narcotine, an opium alkaloid of the benzoysoquinoline series, CCH. 34, which depresses cough but has no narcotic, analgesic or dependence-inducing properties. It is nearly equipotent antitussive as codeine, especially useful in spasmodic cough. Headache and nausea occur occasionally as side effect. It can release histamine and produce bronchoconstriction in asthmatics. Dose. 15-30 mg, children 2 to 6 years 7.5 mg, 6 to 12 years 15 mg. COSCOPIN 7 mg, 5 ml syrup, COSCOTABS 25 mg tab. Dextromethorphan, a synthetic central NMDA, N-methyl D-aspartate, receptor antagonist. The D-isomer has antitussive action while L-isomer is analgesic. Dextromethorphan does not depress mucociliary function of the airway mucosa and is practically devoid of constipating action. Though considered non-addicting, some drug abusers indulge in it. Side effect: dizziness, nausea, drowsiness. At high doses, hallucinations and ataxia may occur. Dose: 10-20 mg, children, 6 to 12 years 5-10 mg. It is a common ingredient of many proprietary cough formulations, see antitussive combinations below, but not advocated for children less than 6 years. SE-Cort-IO. N4. 240 respiratory system drugs. Clofidionol. It is a centrally acting antitussive with weak antihistaminic, anticholinergic and local anesthetic properties. Onset of action is slow and duration longer. Side effect: dryness of mouth, vertigo, irritability. Dose: 20-40 mg. Pranoxdiazine, a drug developed in Hungary which acts as antitussive by desensitizing the pulmonary stretch receptors. Tussle impulses originating in the lungs are suppressed. Efficacy, however, is not impressive. Dose: 100-200 mg TDS, PRENOXID 100, 200 mg tab. Antihistamines. Many H1 antihistamines have been conventionally added to antitussive, expectorant formulations, see below. They afford relief in cough due to their sedative and anticholinergic actions, but lack selectivity for the cough center. They have no expectorant property, may even reduce secretions by anticholinergic action. They have been specially promoted for cough in respiratory allergic states, though their lack of efficacy in asthma is legendary. Chlorpheniramine, 2-5 mg, diphenhydramine, 15-25 mg, and promethazine, 15. 25 mg. Phenergan 5 mg, 5 ml elixir, a com. Mornly used. Second-generation antihistamines like fexofenadine, loratadine, etc. are ineffective. Bronchodilators. Bronchospasm can induce or aggravate cough. Stimulation of pulmonary receptors can trigger both cough and bronchoconstriction, especially in individuals with bronchial hyperreactivity. Bronchodilators relieve cough in such individuals and improve the effectiveness of cough in clearing secretions by increasing surface velocity of airflow during the act of coughing. They should be used only when an element of bronchoconstriction is present and not routinely. Their fixed-dose combinations with antitussives are not satisfactory because of differences in time course of action of the components and liability for indiscriminate use. Fixed-dose combinations of a centrally acting antitussive with a bronchodilator or with an antihistaminic having high atropinic activity have been banned in India, but many are still marketed. Majority of the FDC cough formulations that are marketed and briskly advertised are irrational and have only placebo effect. Aromatic chest rub is widely advertised as a cough remedy. Though it has been shown to reduce experimentally induced cough in healthy volunteers, there is no evidence of benefit in pathological cough. Some antitussive expectorant combinations. ASTHALIN expectorant. Salbutamol 2 mg, guaifenesin 100 mg per 10 ml seer, dose 10-20 ml. ASCORILC, codeine 10 mg, chlorpheniramine 4 mg per 5 ml seer. AXALIN, ambroxol 15 mg, guaifenesin 50 mg, salbutamol 1 mg, menthol 1 mg per 5 ml seer. BRONCHOSOLVIN, guaifenesin 100 mg, terbutaline 2.5 mg, bromhexine 8 mg per 10 ml susp. CADICOFF, GRILINCTUS, dextromethorphan 5 mg, chlorpheniramine 2.5 mg, guaifenesin 50 mg, am. Chloride 60 mg per 5 ml seer. Benadryl cough formula. Diphenhydramine 14 mg, am. Chlor. 138 mg, sod. Citrate 50